One of the things that we hear from patients is around pain management. And for some people, there is a concern about using painkillers, and particularly perhaps morphine-based painkillers. And for others, there's a surprise about how much pain can be generated by lung surgery. So could you talk a little bit about managing pain and expectations of what is normal after you've had surgery?
So partly depends on what type of procedure patient had. Not really how much lung was removed, but actually was it keyhole operation where the incisions are smaller, or was it open procedure when the incision is probably about 25 centimeters or larger? I would expect that with the keyhole operation, the patient might be on strong painkillers, including opioid-based like codeine and occasional Oramor for about 2-3 weeks. And I would expect that after that, they can step down just to paracetamol. If the patient has a larger incision in the form of thoracotomy, then I would expect that they will be on strong painkillers for about 5-6 weeks. And again, after that, they will probably step down just to paracetamol. In most of the patients, that's what happens. Obviously, there are exceptions. So some people might have a pain longer. Some people might have even chronic pain, which lasts basically for life. But I would say that's very rare. And if that happens, then the patient is referred to anesthetists who have a special interest in pain management. And they see the patient and the chronic pain outpatients and clarify what other options treatment they have. In some circumstances, when there's a chronic pain, it might be because the nerve which was initially bruised was somehow damaged, and people usually experience occasional shooting pain, which might be requiring some treatment. So usually so-called gabapentin is a specific medication which dealing with neuropathic pain. So some people are prescribed gabapentin and see how it goes. And if it works, they can be on that long term. If it doesn't affect that, then again, we send the patient to a chronic pain team to manage these patients. But this is usually rare. What I also experienced that a lot of patients have a small niggling pain now and then. Some people might have a little bit of burning sensation, which is usually on the anterior part of the chest, which sometimes is quite distressing for them, but it's nothing to be worried about. It's purely because when we are cutting, making the incision and cutting through the skin and subcutaneous tissue, there are small nerves which are cut as well. We can't avoid that. And partly because we are operating between the ribs. So initially the intercostal nerve, which is running below the rib, is bruised, and it will probably recover as time goes in most of the patients. But obviously the nerve which is cut during the incision, that will not recover, although usually the pain improves as time goes, and usually doesn't require any medications at all. And on some occasion, people might have a little patch of not feeling that area at all, again, because of the damage of the nerve as such. But it's usually a small area and doesn't cause any trouble whatsoever.
Once somebody's had their 5 to 6 weeks or longer, if they've had an open operation, are there any particular long-term difference that they should expect, or should they be able to return to their day-to-day activities after recovery period?
So the recovery period means that the patient is successfully healed from the operation. Obviously, how much the patient will be effective is mainly determined on how much lung we have to remove and what was the underlying conditions of the patient before the surgery and how good were the lung function tests before the operation. So I would expect in a patient who had good lung function tests before operation, he can resume normal activities like before and basically has no limitations. On some occasions, when they are walking steps or hills and it's very, very windy, they can do it, but they just need to slow down and sort of pace themselves according to how they feel, but should have no limitations. Obviously, in the patients who have not very good lung function tests, then it's discussed before the operation if the patient would prefer surgery, which might be with higher risks and also a bit more implications in the form of a little bit worse quality of life. So they might do a little bit less than they do at the time before the operation. or they might be offered alternative treatment. So it just depends on the patient choices before the operation, before we consider what is the best option for the treatment, what is the best treatment option for the patient.